Good evening, everyone. My name is Sharon Moreno. I'm a family nurse practitioner, and my super awesome co-host Ray Martinez got caught up with his chest stuff, so it'll just be me, myself, and I today. How's everybody doing? We're going to start with the legal disclaimer like we usually do. In the meantime, everyone says their highs. Again, guys, if there's a topic that you're interested in, a medical topic that you'd like me to do some discussions on, I'm happy to try to comply with the staff, with my people. So whatever it is whatever topics you feel you'd like for me to speak about, I'm happy to do that. Place those in the comments, say your highs. We'll start with the legal disclaimer like we usually do. And today's topic is diabetes mellitus type 2. It's pretty prevalent here in the valley. I see a lot of patients with diabetes in this area. Hi, Viola. How are you? Thank you for joining each and every show. You've been a faithful listener since I started. Again, guys, don't forget I offer telemedicine services, and I also offer mobile home visits. So if you have, weight loss needs, if you have vitamin B12 needs, you're under the weather and you need some antibiotic injections, or medication refills, I'm happy to help you. Please text me at 956-640-6963 or send me a message through Messenger under Sharon Moreno, and I'm happy to help you. You can also visit my website at www.goldrushhealthsolutions.com. You'll be able to see services I offer, and the website provides a little bit more depth of the particular services that I offer. And you're very welcome, Viola. Alrighty, guys, we'll get started. Again, as I mentioned, our topic today is diabetes mellitus type 2. This is a condition that's pretty common here in the valley, as I mentioned. We have another comment, I guess, before I start. Hi, Norma. How are you doing? Super awesome day, always productive. Um, so we'll get back to the diabetes here that we're going to speak about. We have a lot of things that we're going to talk about. You know me, I love starting with statistics. Statistics gives us a bird's eye view of really what goes on with the condition. So I have three pieces of statistics for diabetes mellitus type 2. And the first one is approximately 22.8% of adults have diabetes and have no idea. So they're actually undiagnosed. So about a quarter of people have diabetes and are undiagnosed. So it's not quite as many as hypertension because unlike hypertension, diabetes has a bunch of symptoms. They're really hard to miss. And we're going to talk about that a little more as I get into the PowerPoint. But yeah, the second piece of statistic is that one person out of 9 have diabetes. That's pretty significant. There's a lot of people with diabetes, and the issue with diabetes is that it causes a lot of sequela to the body that's everlasting. So we really need to catch that early and treat that early. The third piece of statistic that I have is that diabetes was responsible for 3.4 million deaths last year. 3.4 million people died because of diabetes. So that's, again, pretty significant information there. So for these reasons, and of course, it being prevalent in the valley, I decided that diabetes is a topic that I should discuss. Plus, one of my faithful listeners actually recommended that topic. So, all right, guys, well, we'll get started. So an overview regarding diabetes. Essentially, it happens when the body cannot use insulin correctly and sugar builds up in the blood. There's no cure for diabetes. So once you're a diabetic, you always will be a diabetic, but it can be pretty well managed. And that's really important. There's a lot of lab values and stuff that can help us dictate how tightly controlled sugars are. And symptoms can come on slowly. So you may have one symptom now, you may have another symptom, later on down the road. And ultimately, they'll be accumulating as the sugars go higher and the condition is untreated for longer periods. Then you'll end up exhibiting increased symptoms. So speaking of symptoms, here's a list of the symptoms that we have here. We have increased thirst, increased urination, increased hunger, weight loss, fatigue, blurred vision, slow healing sores and or frequent infections, numbness and tingling to feet, and areas of darkened skin that are mostly in the armpits and neck. So that's pretty significant for the reason being that, isn't it ironic that we have an increased hunger, yet weight loss is a possible side effect, or a possible symptom, I should say, of diabetes? Quite interesting. And it has to do with how the body metabolizes sugar and how it excretes it and things of that nature. I have seen that when patients are newly diagnosed with diabetes, they're initially losing weight and they kind of like that. And once we start to manage the diabetic symptoms, then they stop losing weight. So they're not necessarily excited about that particular area. But the three most common symptoms really are increased thirst, increased urination, and increased hunger. So if you feel like you're having one of those symptoms, I definitely recommend you to get checked out. So I have a question here from Norma. She says, what's the difference between type 1 and type 2? So there is somewhat of a significant difference. So type 1 diabetes is when the body does not produce insulin, period. So the pancreas are responsible for insulin production. And with type 1, the issue is the pancreas there's a pancreas problem. The pancreas are unable to make insulin. Whereas type 2, there's mostly two main issues. So the pancreas do secrete insulin, but generally it's not enough to supply the whole body and the demand of the sugars that we're taking. And the second one is resistance. So there may be enough insulin or reduced insulin, but the body isn't metabolizing it and using it as it should. So another huge difference is type 1 diabetics must be on insulin, while type 2 diabetics are not obligated to be on insulin unless we're unable to control that with multiple medications. But that's actually a good question. I don't see type 1 as often, although I have worked with it on multiple occasions, but it's type 2 that's very, very common. And we see that quite a bit. So we talked a little bit about symptoms. And let's continue with causes of diabetes. So the important thing is, how can we get diabetes, or why is this being caused? So this is kind of like what I just explained. Cells, but this is into more detail. Cells in the muscle, fat, and liver don't respond to insulin, and as a result, cells don't take in enough sugar. So this is the resistance part of our body, where there may be enough or reduced, but our body simply isn't using it as it should be used. The pancreas, or the gland that makes insulin, can make enough to keep blood sugar levels within a healthy range. And usually this happens because of weight. We'll see that as people start to gain weight, we'll see pre-diabetes when people are overweight, but as they start to be more on the obese side, then they'll end up with increased resistance and or the lack of enough insulin for the entire body. And again, the analogy I give people when I'm discussing how our body produces hormone is in this manner. So let's say you have a husband who's the breadwinner for himself. He gets, let's say, a $2,000 check every month, right? So if he's just supporting himself, well, $2,000, I'm not sure about this economy, but for the most part, can get you pretty far. You can buy some stuff, you can pay rent, have a, car payment, these kind of things. But let's say the gentleman says, I'm feeling a little lonely. Let me find myself a girlfriend. So he decides, you know what? I'm going to go out date, and he's successful. He finds a girlfriend. So now And this girlfriend comes in and she's not working. So guess what? Now this $2,000 is not only for him, it's going to be for his wants and her wants. So can they survive with $2,000? Perhaps. Maybe he has to tighten his belt a little bit, not go out to eat as much, but I think they can pretty much make it on, him and the girlfriend. Well, let's say after time, they're in a great loving relationship and the girlfriend ends up pregnant and they have a baby. And again, no one is working but the gentleman. So guess what? Now this $2,000 is now for three people. And again, as you see, this $2,000 and or the body will produce a certain amount of insulin. And as demand keeps happening, which in the case of the family I discussed, more family members, but in the case of our body, it's weight gain. So as we continue to gain weight, there's more demand for the insulin, yet there's only that certain $2,000 allotment of insulin. And so that's kind of where these issues happen. All right. And Christina says, hello, beautiful. What tests are needed to confirm the diagnosis? That is a super awesome question. And it's actually going to be later on in the PowerPoint. I can answer now, but if I do, I'll skip over some PowerPoints. But as soon as I do answer that particular question in the PowerPoints, I'm going to remind you that this is the answer to that question. This is an easy question. Doesn't require too much discussion. So what are the target ranges for my hemoglobin A1C? So as soon as we hit 6.5, that's a diagnosis of diabetes, 6.5 or above. So we definitely don't want a 6.5. When I was seeing patients in my clinic, I usually had them run about 6. Now, for those of us who may not know what hemoglobin A1C is, this is a calculation of blood sugars over 3 months. It's a blood test. You go, you get this done, and it provides a range for us. Based on that range, we're able to determine is medication effective, is diet effective, exercise effective, and are able to create a plan of care from there. But for non-diabetics, we want it anywhere close. I like 6 or less. For diabetics, I also use the same range. I tend to be a little bit more aggressive and treat patients at pre-diabetes versus diabetes because research has shown that if we're in a place where we're pre-diabetic, that there's already end organ damage happening. With this increased amount of sugar flowing, we can have damage to small vessels in the eyes, circulation like extremities, kidneys. So it's really important that we manage that quickly. But I got you, Christina. We're going to talk about that. That's a really, really important question. All right, so we're going to continue. So we talked about causes of diabetes. So let's talk about risk factors. We got to stop and think, okay, how much of a risk am I at for diabetes? What I generally tell people is to look at your parents and see what they're doing, because that's a reflection of us as we age. So if my mother has diabetes, high blood pressure, kidney disease, et cetera, that's my picture. That's me looking in the mirror of potential genetics knocking on my door with those diseases. So generally, what we need to do is, if we're predisposed to diabetes, then we really need to watch diet and exercise. High blood pressure, the same thing. Really, a lot of things have to do with diet and exercise. And why? Because it affects our weight and our livelihood. It's really important. So let's talk about some risk factors. Obesity, that is the number one issue. Being overweight or obese is the main risk. If you are overweight and or obese, then you are much more likely to end up with diabetes, especially if genetics is an issue. Waist size. So the more truncal obesity that you have, again, the higher the risk. Why? Because our organs are in this area. And we have fat that ends up going around our liver and vital organs. And so it creates issues. Now, what I mean by truncal obesity is the people who tend to store more fat in midsection, like the abdomen, and are don't store as much fat on arms and legs. Now, other people are set, have their fat kind of distributed more evenly. So they have some midsection fat, they also have two arms, and they have two legs. Those particular people are lower risk versus the people with truncal obesity and or midsection obesity. Sitting, again, we talked about lack of activity. Physical activity helps manage weight. Because it uses up glucose as an energy and helps cells take in insulin. Again, notice the common denominator here is we're looking at waist size, we're looking at activity, we're looking at all these things. Why? Because it has to do with weight gain. We're trying to prevent that. I have another question from Christina. She says, should I consider using a continuous glucose monitor at home? I love continuous glucose monitors for a multitude of reasons. But the two biggest ones are, one, you don't have to stick yourself 1,000 times. And I'm not diabetic, but I've stuck myself on multiple occasions with the prick, with the little finger stick thing, and it's not exciting. And so imagine someone who has to poke themselves 3 times a day, that can be really difficult and create issues when the patient is trying to do activities because we grasp things with our hands. So consider that issue. Now, the second issue with continuous glucose monitor is not only do you not have to stick yourself always or ever, you just do that once a week to apply the monitor, but you have readings at any given point in time. They're always available. So before meals, after meals, whenever you choose without the pain of the finger sticks. So as far as should I use one? If you're not diabetic, I don't recommend that. If you're pre-diabetic, it's a bit overkill. I don't recommend it either. But I do recommend watching diet, looking at exercise, and following up with your provider so that labs can be followed up with. That's important. Now, if you are diabetic, I do recommend it. Now, insurance is a little iffy about this. They generally don't want to cover these kind of glucometers unless you're insulin dependent. Some insurances are a little better than others and they'll cover it for oral anti-diabetics. But for the most part, I usually see that if the patient isn't on on an insulin regimen, then the insurance doesn't cover it. Now, we can always go out and buy our own glucometer, but these things are not inexpensive. They're quite pricey. So, most of us poor people just can't afford them. And so we have to resort to the basic glucometer sticks that aren't exciting. Great questions. So let's continue on with risk factors here. So we have family history. Again, we talked about that as well, about your parents, your grandparents, your siblings being your mirror. Look at these people and see what are they doing, because guess what? That's likely what you're going to be doing. Having a parent or sibling with diabetes raises the risk. Okay. Race and ethnicity. African American, Hispanics, Native Americans, Asians, and Pacific Island people are at higher risk. So if you belong to one of these races and or ethnicities, again, we have to be cognizant that we're at higher risk. And why do you think that is? Genetics, culture. I can honestly say that for the Hispanic culture, it has to do with a lot of carb consumption. The diet is quite rich in carbs, and that's the whole issue with diabetes. There's a misconception that it's sugar consumption, but the reality is it's carbohydrate consumption that we need to be watching. So let's talk about a few more risk factors there, because there's quite a few risk factors. Unfortunately, with these illnesses that are devastating and long-term, there tend to be a lot of risk factors that can cause this. So we look at blood lipid levels. We want to look at HDL levels. HDL levels is the good cholesterol. This is the cholesterol that tells us about heart attack risk. The higher the good cholesterol, the better, the less likely that you'll end up with, these sorts of cardiac and, diabetic related issues. We also look at triglycerides. Triglycerides is a bad cholesterol. It's the liquid portion of the cholesterol. If you have high levels, generally anything over 150, then you place yourself at higher risk. So for triglycerides, I tend to, it's, it can be two things can affect that. Poor diet. So when I see a patient with high triglyceride levels, I know that their diet is pretty rich in fat. It's a poor diet. So I usually put them on things like omega-3 fish oil. You can do 1,000 milligrams in the morning, 1,000 at night, just depending on how high the triglycerides are. I will tell you, I have a pearl that I've learned over the years with the omega-3 fish oil. So a lot of people tend to not be as compliant with them because they burp this fishy taste. So what I tell my patients is to put that bottle of fish oil in the freezer so that that gel capsule freezes and or becomes more viscous. The reason people are burping these fish oil tablets is because when we swallow them, they rupture in your stomach and it causes that burpy, fishy taste. But if we put them in the freezer and we allow that um, the gel to be more viscous, then what happens is it usually lasts until it's in the intestinal area and it ruptures in the intestine. Once it ruptures, then you're not going to have that burpy fish taste because you do have sphincters and stuff that control that backflow of the burping and stuff like that. So that's a pearl for fish oil if you take that. Um, and of course, you're very welcome. That's what we're here for. We're here to inform the public of issues with diabetes. So keep the questions coming. I have no problems with that. Again, I hate to attribute anything to age, and you can ask my patients. I rarely say people be like, oh, well, I'm losing hair. It's my age, right? Or I feel tired. It's my age, right? I will tell patients, I literally attribute nothing to age. It has to do with comorbidities that tend to attack us as we age, but the age solely is not the issue. So we have an increase after the age of 35. So that's quite a few of us. It's a pretty young age. Again, pre-diabetics, condition where blood sugar is higher than standard range, but not high enough to be diabetes. So this is a time where we need to be aggressive, where we need to start treatment. We need to do weight loss regimens, whether it be increased activity, modify a diet, or weight loss with the use of prescription pills. Whatever it takes to lose the weight, that's a healthy way, is important because we can't have short-term um, solutions because one, we'll end up gaining the weight back. And two, we always have to make sure that whatever we choose to do is safe because we don't want to prevent one unsafe condition to get to another unsafe condition. Those kind of coping mechanisms and changes aren't going to work out too well. Pregnancy. For the females who end up pregnant and have something called gestational diabetes, which is essentially diabetes, high sugars during pregnancy, and this is simply during pregnancy. So they weren't diabetic before. Once they have the baby, then they won't be diabetic anymore at that point in time. But having had this condition places us at higher risk for actually having diabetes down the road. So it's kind of like a warning sign that says, hey, kind of like a TIA and stroke, a CVA. A TIA is kind of one of those things that people sometimes refer to as a mini stroke. If you had a mini stroke, the stroke is knocking on your back door and you need to make changes. And so that's what gestational diabetes is. Um, polycystic, polycystic ovarian syndrome. It's a condition that results in irregular periods, excess hair growth, and obesity. So this is something that happens with females. You'll see them with like facial hair, again, truncal obesity, periods that are irregular. And so this is a condition that, we look at treating. Again, the treatment for that is a medication that we use for diabetes called metformin. So again, the goal here is to reduce weight gain and or truncal obesity so that we can be further away from diabetes if that really is the situation. So let's look at complications of diabetes. So heart disease. So let's say we have diabetes for X amount of time, and it's been uncontrolled. It's poorly controlled, meaning that our hemoglobin A1C is higher than 6 or 6.5. So what are the complications? What things can happen to us in the long run as a result of uncontrolled sugars? Well, these are the things. These are the complications. So heart disease, again, linked to stroke, high blood pressure, and narrowed blood vessels called arteriosclerosis. If we have, and we talked about heart disease, we talked about actually high blood pressure last visit. We talked about how narrowed blood vessels and or clogged blood vessels with cholesterol can increase blood pressure. So not only are we now having diabetes, but now we're having complications with our heart. Do you remember some of the signs and symptoms of high blood pressure and or failing heart? Shortness of breath at rest, swelling to your ankles, cough that's dry, cough with clear phlegm, activity intolerance like fatigue. So it's quite a few things. And as this disease progresses, again, devastating symptoms that affect activities of daily living, like just even eating. So we look at nerve damage in arms and legs, things like numbness, tingling, burning pain, or loss of feeling that starts at the tips and moves upwards. This is known as neuropathy, and when it becomes to more than one area, is polyneuropathy. This is very, very common in diabetics. So this is the reason why we always have patients physically look at their feet and tell them not to go barefooted. Because I can have someone who's diabetic walking around their house and they accidentally step on something. It could be something that's sharp, nicks their skin, cuts that open, and they can end up with ulcers and have no idea. I don't know how many times I've had patients present to me and say, with severe ulcers on their feet, and say, I had no idea I had this. I didn't even feel it. The only reason I knew something was wrong is because I smelled something bad and I looked. I was looking all over the place and I noticed it on my foot. So the smell warns them. They have bad ulcers that are draining pus and stuff, yet don't feel it. Another thing that I ask them to do is anytime they're going to take a bath, make sure they're not, how many of us, we're going to take a shower or a bath, we put our foot in there first, dip our foot in there to see if the water's warm or hot or what the temperature is. Somebody with decreased circulation or neuropathies may burn their toes because they don't realize, again, the temperature of the water. So these are some things that once patients are diabetic, we really have to work hard to teach them. Teaching and prevention is extremely important. And that's another reason why I'm actually here in the community giving these presentations, because sometimes the provider may not take the time that's needed to discuss these certain things. But if you have this condition, you can always listen to my presentation, join me, ask questions, and we can get that situated for you and help you better manage your condition and help reduce complications. So we have other nerves, not only in the arms and the legs, we have other nerves like heart valves. We have problems there. We can cause arrhythmias. We have nerves in the digestive system. They can cause diarrhea, constipation, nausea, vomiting, and erectile dysfunction. They're big issues. I kid all the time with my male patients because I can tell them your diabetes is going to affect your kidneys. It's going to affect your heart. It's going to affect your eyes. And that doesn't seem to faze them that much. But when I tell them that it can cause erectile dysfunction, they really want to make changes because they don't want to lose that particular appendage. And the way I see it, whatever works is good for me. So if that particular damage to that particular appendage is going to help them get serious about their diabetes, let's do it. Again, the heart has nerves. They have the Purkinje fibers. This is where our rhythms are set. And if that's affected, then you can have arrhythmias that can create things like blood clots or rapid heart rates that make you feel ill and end up in the hospital. So they can be some devastating things. Again, we talk about the digestive system. Diabetics are very well known to have issues with their digestive system, especially constipation. Why? Because the intestines don't work as they should. Something called gastroparesis, diabetic gastroparesis. The way we move our bowels is through movements of the intestines, and the diabetes, when there's damage to this area, to these nerves and the movement, it affects the movement, which is called peristalsis. So the peristalsis is not happening as it should. So the fecal material starts to build up in the intestines. And now you have people who are having bowel movements once every 3 to 5 days, and sometimes even further than that. So again, these are things we have to manage. We have to ask patients, how are your bowels? Are you going to the restroom regularly? And help alleviate some of these symptoms. Kidney disease, chronic kidney disease, and or stage renal disease that requires dialysis. We talked about diabetes affecting small vessels. So the eyes and the kidneys are two areas that have smaller vessels that are greatly affected just by even small changes in things like sugar and blood pressure. So it's extremely important for people to be aggressive when it comes to treatment of blood pressure and the diabetes, because if not, if we have decreased kidney function, well, what do the kidneys do? They filter our blood and remove toxins, fluids, waste. So think about a trash can. You know, you're cooking and you put stuff in a trash can. If that's being taken outside and the trash truck is coming every week, well, things are working pretty well. But let's say the trash truck doesn't come week 1. What's going to happen then? Let's say the trash truck doesn't come week 2. What's going to happen then? Your house is going to start to smell. There's going to be flies. There's going to be maggots. So there's going to be quite some issues because, again, this is trash. This is toxins. And it's an issue. Okay, so we have another question from Christina. She says, is diabetes a disability? I heard diabetes is considered a disability under federal law, and that is absolutely correct. So diabetes can be considered, not all diabetics will be considered disabled, but yes, it is one of those diagnoses that can disable you, especially if you have devastating side effect complications like heart disease, nerve pain, kidney disease, all of these things. Yes, absolutely it is. And as a result, remember that disabilities require non-discrimination laws. So let's say, Christina, you go to a job and somehow the employer has realized that you're a diabetic and you need to take breaks to take your blood sugar and take your insulin. The employer is not supposed to discriminate on giving you a job based on that disability. Otherwise, they can get into a lot of legal trouble with that. I'll be honest, I don't recommend disclosing your health-related personal stuff because unfortunately, some people can use that against you. And sometimes it's a little harder to prove that that's why they didn't choose you as an employee. So really, when you're going through an interview, you should not disclose your medical history. To me, it just seems like it dings you instead of really helping you. Once you're hired, once you're an employee, then you can say, okay, I require special accommodations. Unless the employer asks, okay, is there anything that would require special accommodations? Well, we don't want to lie. We can say, yes, there is. At this point, it wouldn't, interfere with my work or whatever it is. You don't have to get into specific details. But yes, that's actually a really good question. Good question. We talked about depression a couple of classes ago, a couple of shows ago. And remember, that was the number one disability amongst people from 15 to 45 years old. So you're asking about diabetes. Depression was the number one reason that was disabling people, 15 to 45 years old. So yes, great question. So let's continue with complications. We look at hearing impairment. This is absolutely not uncommon. How many times do we see people who are older with heart issues, kidney issues, and things of that nature with hearing impairment? Why? Because it's a nerve that helps us hear. It's the nerve that sends signals to the ear and gives us the messages that we're hearing. So again, we talk about nerve damage. and hearing is one of those things that can be impaired. So we want to continue with complications. There's a lot of complications to diabetes. Skin conditions. We look at bacterial and fungal infections. So I have this one patient that has seen me for multiple episodes. He's a cash paying patient, and he saw me with a generalized fungal infection. He had it in his chest, he had it in his stomach, he had it on his legs. It was large area. We're not talking about small areas. We're talking about really big areas. He came to me. It was pretty widespread. I treated him. Then he came to me 2 months later and said, it's back. So I told him, I need for you to go get tested for diabetes because this absolutely should not be happening. Fungus likes dark, likes that sweet sugar environment. And unfortunately, diabetes gives that environment to people, causing these particular conditions. Bacteria is the same way. You know, the sugar is a food source for them. So it's like, wow, life is great here. And so they tend to prey on opportunistic people with opportunistic illnesses. Now, diabetes mellitus, understand, it creates you to be in a place that you're immunocompromised. So normally, if your white blood cells and your immune system's fighting against these illnesses, well, guess what? Diabetes kind of places them somewhat reduced and or dormant. So when they're supposed to be up and ready with their firearms, what's happening with people with diabetes and other illnesses is now they're taking siestas. They're getting tired, and so they're putting their weapons down. And during that time frame, the illness, of course, the enemy comes in and says, oh, there's a great opportunity to come in, and no one's protecting the fort. So they come in and attack us during this time. So we have another question. Christina says, is it true that diabetics shouldn't drink cold water? That is a myth. So generally, I don't restrict temperature related drinks to anybody with diabetes. What I will restrict, and not only to diabetics, but to weight loss patients, and everyone that I hear, is that we should not be drinking our calories. So get rid of the juices. The only thing I'll accept is milk. And it should be fat-free milk. So reduce fat intake and reduce calories. Again, remember, calories affect how we gain weight as well as movement does. So cold water, I have no problem with that. You can drink that, and that's probably a myth. Slow healing infections. So we talked about these bacterial and fungal infections, and now instead of healing over 24 to 48, 36 hours, now we're talking about weeks. On this particular gentleman that I treated, you know how long I gave him a treatment in order for the entire rash to be away? 3 months. 3 months. When normally someone without diabetes, the longest I treat is usually about a month. And these are like foot funguses and stuff that I'll use creams for, but a month. And him was 3 months. So look at the difference in treatment time. You're now obligated to take medications for an extended period of time. Remember, medications are poison as well. They have side effects. So the patient has to choose their poison. Do I drink this poison? Do I drink that poison? And my job is just to educate, say, okay, we don't treat the fungus. Well, guess what? It's going to keep spreading. You're going to have uncomfortable symptoms like itch, scaling, skin breakdown can turn into infections. We give you a medication. You're also going to have side effects. Now it can affect your liver, it can affect your kidneys, can give you a bad taste in your mouth, et cetera, depending on what we treat with. So that's kind of that situation. A lot of stuff there. So we look at eye damage. We spoke about the eyes earlier. Things like cataracts, glaucoma, damage to the blood vessels or the retina. What does the retina do? This is the area that senses light. So guess what? If we have issues with light perception, you think that's going to be a good situation? No. Now people are going to have difficulty reading. People gonna be driving, have difficulty seeing shades of stop signs. I'm sorry, stop lights. And what does that mean? A big problem. I've seen patients where they've been ill. We literally had a patient in a clinic I worked with some time ago, lost control of his car and ran into the parking lots and the sign of the clinic. So these kind of accidents can happen. Things like seizures, falling asleep behind the wheel. They can be devastating and not only affect the patient's life because they can get killed, but they can kill other people. So again, eye damage can ultimately lead to blindness. Now, as part of diabetic regimen, we have to do a few things. We have to send them to the eye doctor. We need to make sure that their eyes are getting checked routinely. Look for cataracts, look for glaucoma, look for risks to help reduce or extend the possibility of being blind. We need to send patients to get foot exams with the podiatrist, have their toenails trimmed, good foot care, calluses shaved and removed, offer diabetic shoes to people with severe polyneuropathies, this numbness and tingling, to help them with that. So again, these issues are devastating, but us as medical providers need to help guide patients to help reduce these complications. We look at dementia. Why? Poorly managed blood sugars have been linked to faster memory loss because there's decreased circulation. Remember, we talked about the diabetes affecting small blood vessels and circulation. The head is an appendage. So we have decreased circulation there. Again, it affects our cognitive reasoning. Sleep apnea is another thing. Sleep apnea is where we end up stopping breathing for a few seconds overnight, and this happens throughout the night. And this can be devastating because as every time we stop breathing for a few seconds, it increases the heart rate and places a strain on the heart. As time happens, the heart is a muscle. And like our biceps, if we use it a whole bunch, it increases in size. Unfortunately, when the heart increases in size, this is a bad thing. This is not a good thing. The heart's going to say, you know what, forget y'all are not helping me. I'm going to stop working or I'm going to work less. And if the heart works less, remember we talked about symptoms associated with heart failure, swelling, cough with dry cough, cough with phlegm, shortness of breath, even to the point where eating is an issue. So we have some questions and comments here. I have Juliana here. Hi, Juliana. Thank you for joining me. I think this is show number 2 for you. You were on last time, so I think we're doing really, really good there. So thank you for joining me. And you have a question. You say, actually a comment, I wasn't aware that one of diabetes complication was dementia. Yes. Decrease basically cognitive impairment. So remember that if we have decreased circulation, essentially your entire body will be affected. Remember that circulation is blood flow. Blood flow is what provides oxygen, nutrients like sodium, potassium, calcium, all of those things. And if your body's not getting, if certain organs aren't getting the attention that they need, well, then what happens? We're sort of malnourishing the brain. And if you're not getting those vitamins, then guess what? Your brain will suffer in the form of memory loss or forgetfulness. Norma has a question here. She says, is a diabetic urine sweet? Someone told me that a diabetic will have an ant infestation in their bathroom. So I don't know what people you're talking to about the ant business. I think that they have the ant infestation and their sugars are 2 different things. I would recommend fumigating the house with something like Home Defense. That works pretty well. I use that and I have no ants in my house. I also don't have diabetes either. But so about the ant thing, that's a bit far-fetched. Unless I can't imagine that. Are they urinating on the floor? I mean, how do ants just go to the urine? I mean, I'm a bit confused with that. But so is diabetic urine sweet? The answer is yes, it can be sweet. or should I say, produce a sweet smelling smell. You can also see this from your breath, especially when they become in a place called keto, when they become the ketoacidosis, the keto diabetes, they end up having kind of like a fruity breath. So sometimes you're talking to people, it's like, wow, it smells kind of sweet. This is a severely uncontrolled diabetes. This is a really bad situation where sugars could be 400, 500, 600 in the thousands. So this is somewhat of an issue. I wouldn't recommend tasting your urine. I've never done that. Um, but I think it's more like the fruity breath and the smell. I will say though that your urine tends to produce an aroma of what you eat. So let's say you ate Fruit Loops for the day. You're probably gonna have sweet smelling urine because of all the sugar in the Fruit Loops. Remember, our kidneys filter out what we don't need. So if we have excess sugar floating around, your kidneys are gonna try to pull that out. Yeah, I can see that happening. Males that sprinkle when they tinkle, maybe. I mean, yeah, they, yeah, that's a big issue. I can talk about that an entire video myself. That's somewhat of an issue with not lowering toilet seats and urinary issues. But yeah, they have a bigger problem if they can't aim correctly in the toilet. Um, but yeah, I'm not expecting to see ants in that place. I'm expecting the bathroom to smell like an old porta potty, but not necessarily ants that are kind of hanging around there looking for some love in the urine. All right, let me see. Okay, I think I got all the questions there and comments. So, Christina, these are the answers to your question about how is diabetes diagnosed. So what's important is we want to know how can we get a diagnosis. So there's a couple of ways, just depending on what route we choose. Blood hemoglobin A1C is 6.5 or higher. So at 6.4 and before, we're pre-diabetic. But at once it says 6.5, you are considered diabetic. Remember, hemoglobin A1C is a calculation of blood sugars over 3 months. So this gives us a bird's eye view of what your body has been doing. One or two blood sugars don't give us that as much perspective, although they do shed light and offer valuable information. But the hemoglobin A1C is what gives us the 3-month calculation. So that's really important. I like to use that. I personally use that as my diagnosis. If I have abnormal blood sugars, I'm definitely going to order a hemoglobin A1C and see what that patient is doing. The second way is through random blood sugar. So random, we can take blood sugars at different points of time. So when you wake up and you're fasting, that's considered a fasting glucose. If you take a blood sugar after you've eaten or any time throughout the day when there's already been food intake, it's considered a random blood sugar. So random blood sugar of 200 or higher. Anything over 200, even random, your sugar should not be higher. Your sugar should not be 200. No way. So if we have a random blood sugar of 200, guess what I'm going to be ordering? A hemoglobin A1C. The next criteria is a fasting blood sugar of 126 or higher on two different occasions. Two different occasions. So let's say you come in to do your labs today and you're 150, and in 3 months you come and you're 180. Is that two different fasting blood glucoses? Yes. Can I give you the diabetes diagnosis then? Yes. Generally, what I do is order a hemoglobin A1C because I want to know how you're doing. We treat sugars mostly based on hemoglobin A1C. Although, when I'm increasing or changing doses, I do have patients come in and give me blood sugars, what I refer to as a blood sugar log, where I look at AM and PM sugars and then modify medications based on that. So it does serve a big purpose. The other one is not super common. I rarely see this, but I have seen it on occasion, is the oral glucose tolerance test. This is used mostly for pregnant females or patients with cystic fibrosis. Cystic fibrosis is one of those illnesses where patients have increased cough and phlegm. It's a horrible horrible thing. If you don't know about it, great. You likely don't have it. It's not super common, but it's common enough that it exists. So with these particular patients, we look at 200 milligrams per deciliter over 2 hours. You know, they're drinking this very sweet drink, and we wait a certain amount of hours, then labs are drawn, and then the results are reviewed. And this is what we get here. So that's a diagnosis. Again, I want to talk a little bit about a diet for, I didn't create any PowerPoint slides for that, you know, that this is pretty much the last one, but I do want to talk a little bit about a diet for the reason being that it's extremely important. So if I have a patient who's diabetic, either new onset or ongoing period, what we want to do, as I mentioned earlier, is we need to talk about carbohydrates. Carbohydrates is what affects sugar. It's not sugar. People think, oh, I can't have sugar. Sugar is a carb, but sugar is not the only carb. It's things like pastas, tortillas, and that nature that's going to affect your glucose. So I tell people, if you're diabetic, you need to do 45 grams of carbs 3 times a day, and you need to have 2 snacks in between that. And those snacks are going to be 15-gram snacks. So you have to become somewhat proficient at reading labels. Remember, a whole package of cookies is not a serving. It's per serving size. 2 cookies is like 200 calories. So you really have to look at, okay, I'm looking at 100 carbs per serving and not per the whole package. So that's something that's really important. I have some comments and questions here. Juliana says, when your saliva tastes sweet, can that mean you're diabetic? I have a coworker who has mentioned that. So what I would tell that coworker is she needs to be evaluated, especially if she has other symptoms like increased thirst, increased hunger, increased urination, and she's overweight. Okay, I'm assuming she's a she, but I can't assume she's a she. The coworker, if that coworker has increased thirst, increased hunger, increased urination, as well as the sweet tasting saliva, yes. I won't use sweet tasting saliva as a diagnosis for diabetes, but it certainly warrants further investigation. That's important. Christina says, my brother has diabetes and they don't have that false information. Okay, so that's great. We don't want people to have false information. I always offer my cell phone number. That's extremely important for the reason being that if people have questions, I want them to be able to ask questions. You can always text me. I don't charge for asking questions. If you have a concern about, hey, I'm having this symptom, I have this doubt, I have this lab result, questions that you may have, I always open up my cell phone and my Facebook to people who need stuff. Whether you have insurance or not, I don't care. Again, if I'm not going to give you a treatment, I'm not going to charge you. I want to be a resource to the community and help people with things. The reality is, if you have questions, you should be comfortable talking to your physician, or I should say provider, your medical provider, and asking these questions. If you don't feel comfortable, or you feel that's not ample time to speak to your provider and ask questions regarding your health, I tell people that medical providers are like taco stands. There's literally 1, 2, or 3 on every corner. Change the provider and get the help you need. You should have access to ask questions when they arise. Have your visits, schedule them, and your provider should be teaching, counseling, and giving you the ample time to ask questions. If they're not doing that and you want my help, again, I'm happy to offer that. My flyer lists my cell phone number. I'm under Sharon Moreno for Facebook. You can send me something through Messenger. My website, www.goldrushhealthsolutions.com, also has a messaging system. So I'm not tech savvy. But I guarantee you that I'm going to find a way to communicate with somebody if I have a daunting question. I'll go looking for them at their house if I need to ask a question. So that's, I want the patients to have the ability to have that resource. So again, if you have a question, I'm having this symptom, should I get evaluated? My mother has this, whatever. I'm happy to help. Let me see about questions. I don't see any other questions at this moment. Guys, if you have topics that you want me to discuss, please. I'd love to cater to whatever topics of interest they may be. Again, I have no problem choosing topics. I've got plenty of topics, but I want to know what it is that you want to hear about. And I appreciate the diabetes suggestion. It doesn't have to be here. If you're feeling a bit shy and don't want to, speak your recommendation in the public, you can send me a message to Messenger. Hey, Sharon, I'd like some information on this particular topic, and I'm happy to help. This is extremely important. I want to provide education to the community so that we have the resources we need when we need them, especially on diagnoses that are so debilitating, that have a lot of complications associated with them, and something that's extremely prevalent. What I'd like is for people to be proactive instead of reactive. So even if you have zero symptoms, go to your medical provider and say, hey, I'm here. I want to see, I'm doing great. I feel great. I'm here for a physical exam, and I'm here to get my labs done, because you'll be surprised at the amount of things we're able to catch early. Things like thyroid disease, decreased kidney function, elevated liver enzymes, infections, cancers. So all of these things are really important. If you just go once a year, get your labs done, get a physical exam done, and get your screenings done, mammograms, pap smears, colonoscopies, all of these things serve a huge purpose. And I have a suggestion here from Christina that says STDs. So a topic on a presentation on STDs. Absolutely. I have seen a lot of those, and they don't look very exciting. So yes, actually that is a great topic. I like that. I don't think I had thought about that particular one at this point, but I think that's a great topic. Great topic. There are so many STDs, and some of them are devastating, like syphilis that has devastation in the older years. People will end up with cognitive changes, confusion, and psychosis, and we end up looking for syphilis to see if this was something that wasn't treated when they were younger. So yeah, STDs can have, you know, devastating and long-term effects on people. You think it's just more, directly to the genitals, but it can have other devastating issues as well. So thank you, Christina. Sorry, Norma. Thank you, Norma. That's a great topic for, I don't know why I say Christina. I don't know. Somehow I thought Christina gave me that suggestion. Sorry, that's Norma. That topic, because Christina made a comment right above it. Anyhow, so we're coming up to the hour already, guys. I think this is week 5 of presenting shows, if I'm not mistaken. Please continue to bring viewers to my show. If they don't have Facebook, they can do YouTube. This is important. I want the more people that follow, the longer I tend to do it. If I have people who are not following, I'm not getting the audience, then essentially my thoughts are going to be, no one loves me, and no one wants to listen to me. So then I'll tend to think, okay, I better stop doing them. But as long as I get, all these great questions and responses and suggestions, I'm happy to continue, doing these segments. That's really important to me. If we don't have any last minute questions or comments, then that's pretty much going to be it. Again, I thank you guys for spending time with me, and being my biggest fan. I plan to continue to do this for some time, and we'll go from there. Okay. Until next week, I'll see y'all at Wednesday at 8:00 p.m. Ray, don't you forget about me next week. Otherwise, We may have to consider a new co-host. I'll see you guys then, okay? Thank you. Bye-bye.